Would you like free audiobooks? Click the link in the description. Question 1. A 35-year-old patient with a recent diagnosis of multiple sclerosis, MS, asks about the progression of the disease. How should the nurse explain the typical course of MS to the patient? A. Most people experience a steady decline without periods of remission. B. You can expect rapid progression of symptoms within the first year. C. MS is characterized by periods of relapse and remission. D. Symptoms typically progress only in the later stages of life. Correct answer. C. Rationale: MS is known for its unpredictable course, but it most commonly presents with periods of relapse, when new symptoms appear or old ones worsen, and remission, when symptoms improve or disappear. This cycle can vary greatly among individuals in terms of frequency and severity. Question 2. Which symptom is least likely to be found in a patient suffering from multiple sclerosis, MS? A. Intention tremor. B. Hyperreflexia. C. Heat intolerance. D. Peripheral edema. Correct answer. D. Rationale: peripheral edema is not a typical symptom of MS, as MS primarily affects the central nervous system, leading to symptoms such as intention tremor, hyperreflexia, and heat intolerance due to nerve damage and the resulting impairment of bodily functions. Question 3. A patient with multiple sclerosis, MS, is experiencing an acute exacerbation. Which medication does the nurse anticipate will be ordered to manage this exacerbation? A. Oral prednisone. B. Intravenous immunoglobulin, IVIG. C. Acetaminophen. D. Baclofen. Correct answer. A. Rationale: during an acute exacerbation of MS, high-dose corticosteroids, such as oral prednisone or intravenous methylprednisolone, are commonly prescribed to reduce inflammation and shorten the duration of the attack. IVIG may be used in some cases, but corticosteroids are the first line of treatment. Acetaminophen is used for pain management, and baclofen is used to manage muscle spasticity, not acute exacerbations. Question 4. The nurse is providing care for a patient with MS who is experiencing difficulty with coordination and fine motor skills. Which intervention is most appropriate to assist the patient with daily activities? A. Encourage complete bed rest to conserve energy. B. Provide tools with enlarged handles for easier grip. C. Recommend the use of heavy blankets at night. D. Limit fluid intake to reduce the need for bathroom trips. Correct answer. B. Rationale: providing tools with enlarged handles can help a patient with impaired coordination and fine motor skills to maintain independence in daily activities. Encouraging complete bed rest can lead to muscle weakness and other complications. Heavy blankets might make moving in bed difficult, and limiting fluid intake can lead to dehydration and urinary tract infections. Question 5. A nursing student is learning about the pathophysiology of multiple sclerosis, MS. Which statement by the student indicates a need for further teaching? A. MS involves an autoimmune response against the central nervous system. B. In MS, the myelin sheath of neurons is damaged, leading to decreased nerve conductivity. C. MS primarily affects the peripheral nervous system. D. The exact cause of MS is unknown, but it involves a combination of genetic and environmental factors. Correct answer. C. Rationale: MS affects the central nervous system, CNS, not the peripheral nervous system, PNS. This misconception indicates a need for further clarification, as understanding the difference between CNS and PNS involvement is crucial in grasping the pathophysiology of MS. Question 6. A patient with MS reports fatigue as the most disabling symptom. What is the nurse's best response to help the patient manage this symptom? A. Try to stay active and exercise as much as possible. B. It's important to schedule daily naps and rest periods. C. Limit your intake of fluids to avoid feeling bloated. D. You should stay awake during the day to ensure a good night's sleep. Correct answer. B. Rationale: for patients with MS, managing fatigue involves energy conservation techniques such as scheduling daily naps and rest periods. Staying active is important but should be balanced with rest. Limiting fluid intake and staying awake all day may exacerbate other symptoms and are not effective strategies for managing fatigue. Question 7. During a community health fair, a nurse is explaining how multiple sclerosis, MS, can impact an individual's emotional health. Which statement should the nurse include? A. Most individuals with MS do not experience changes in emotional health. B. Depression and anxiety are common due to the chronic nature of MS. C. MS primarily causes physical symptoms, so emotional health remains stable. D. Emotional disturbances occur only in the late stages of MS. Correct answer. B. Rationale: depression and anxiety are common among individuals with MS, influenced by the chronic, unpredictable nature of the disease and its impact on life roles, mobility, and general well-being. Emotional disturbances can occur at any stage of the disease, not just in the late stages. Question 8. The nurse is teaching a patient with MS about bladder management. Which suggestion is most appropriate? A. Limit fluid intake to reduce urinary frequency. B. Use caffeine to stimulate bladder function. C. Schedule regular bathroom trips throughout the day. D. Practice pelvic floor exercises only when you experience symptoms. Correct answer. C. Rationale: for bladder management in MS, it's recommended to maintain a regular schedule of bathroom trips to avoid incontinence and reduce the risk of urinary tract infections. Limiting fluid intake and using caffeine may exacerbate bladder symptoms. Pelvic floor exercises should be a regular practice, not just when symptoms are present. Question 9. A patient with MS is concerned about the risk of developing osteoporosis. What is the most appropriate nursing intervention? A. Advise the patient to avoid weight-bearing exercises. B. Recommend a diet high in calcium and vitamin D. C. Suggest limiting outdoor activities to prevent falls. D. Encourage the use of high-dose corticosteroid treatment for MS symptoms. Correct answer. B. Rationale: patients with MS are at increased risk for osteoporosis, partly due to decreased mobility and potential use of corticosteroids. A diet high in calcium and vitamin D, along with weight-bearing exercises, can help maintain bone density. Limiting outdoor activities and the use of high-dose corticosteroids without medical advice are not appropriate recommendations. Question 10. A nursing student is presenting a case study on a patient with multiple sclerosis, MS. The student describes the patient's initial symptoms as blurred vision, diplopia, and a red-green color distortion. These symptoms most likely indicate involvement of which part of the central nervous system? A. Cerebellum. B. Spinal cord. C. Optic nerves. D. Brainstem. Correct answer. C. Rationale: blurred vision, diplopia, double vision, and red-green color distortion are indicative of optic neuritis, a common initial symptom of MS involving inflammation of the optic nerves. This condition affects vision and is not directly related to the cerebellum, spinal cord, or brain stem, which have other primary functions and associated symptoms. Question 11. A patient with multiple sclerosis, MS, reports experiencing electric shock sensations when bending the neck forward. The nurse recognizes this symptom as A. Uthoff's phenomenon. B. Lermite's sign. C. Romberg's sign. D. Charcot's triad. Correct answer. B. Rationale. Lermite's sign is characterized by an electric shock-like sensation running down the back and into the limbs, and can occur with neck flexion. This symptom is commonly reported in MS due to demyelination in the cervical spine. Udhoff's phenomenon involves a temporary worsening of symptoms with heat exposure. Romberg's sign relates to balance, and Charcot's triad includes nystagmus, intention tremor, and telegraphic speech, which are not related to the described symptom. Question 12. When teaching a patient with MS about managing spasticity, which recommendation should the nurse prioritize? A. Increase intake of caffeine and alcohol to relax muscles. B. Engage in regular, moderate-intensity aerobic exercise. C. Remain in a seated or lying position for most of the day. D. Apply heat pads to the affected muscles frequently. Correct answer, B. Rationale. Regular, moderate-intensity aerobic exercise and stretching can help manage spasticity in MS by maintaining muscle tone and flexibility. Caffeine and alcohol can actually exacerbate spasticity and other MS symptoms. Remaining sedentary for extended periods can lead to muscle stiffness and weakness, and while applying heat may provide temporary relief, it can also worsen symptoms for some individuals due to Udhoff's phenomenon. Question 13. A nurse is caring for a patient with MS who is experiencing cognitive changes. Which intervention is most appropriate to support the patient's cognitive function? A. Encourage multitasking to improve cognitive flexibility. B. Provide detailed explanations at once to enhance memory retention. C. Use written schedules and reminders to aid in task completion. D. Limit social interactions to avoid cognitive fatigue. Correct answer. C. Rationale. Cognitive changes in MS can include difficulties with memory, attention, and executive functioning. Using written schedules and reminders can help patients manage daily tasks and commitments more effectively. Multitasking can overwhelm a compromised cognitive system, and while detailed explanations are helpful, they should be delivered in manageable segments. Encouraging, rather than limiting, social interactions can support cognitive function and emotional health. Question 14. The nurse is reviewing the medication list of a patient with MS who is prescribed interferon beta 1A. What is the primary purpose of this medication in MS management? A. To promote remyelination of nerve fibers. B. To relieve acute MS exacerbations. C. To reduce the frequency of relapses. D. To manage chronic MS symptoms like fatigue. Correct answer. C. Rationale. Interferon beta 1A is a disease-modifying drug used in MS to reduce the frequency and severity of relapses by modulating the immune response. It does not promote remyelination, relieve acute exacerbations directly, corticosteroids are used for this, or manage chronic symptoms like fatigue. Question 15. A patient with MS expresses concern about the risk of transmitting the disease to their children. What is the nurse's best response? A. MS is directly inherited, so your children will definitely develop the disease. B. There's no genetic component to MS, so there's no risk of your children getting it. C. While there is a genetic predisposition, having MS does not guarantee your children will develop it. D. Only male offspring are at risk of inheriting MS. Correct answer, C. Rationale. MS is not directly inherited, but there is a genetic predisposition that may increase the risk. However, having a parent with MS does not guarantee that a child will develop the disease, and the risk remains relatively low. MS can affect both males and females, so gender does not determine inheritance risk. Question 16. During a home health visit, a nurse evaluates the living environment of a patient with MS who has mobility issues. Which recommendation is most appropriate to prevent falls? A. Install low-pile carpeting throughout the home. B. Ensure that all rooms have ample natural lighting. C. Remove all rugs and mats from the floor. D. Keep the patient's pet outside or in a designated area away from walkways. Correct answer, C. Rationale: removing rugs and mats can reduce tripping hazards for individuals with mobility issues. While low-pile carpeting, ample lighting, and managing pets are helpful, the removal of loose floor coverings directly addresses a common cause of falls. Question 17. A nurse is discussing dietary considerations with a patient with MS. Which nutrient should the nurse emphasize as important for supporting nerve health? A. Saturated fats. B. Omega-3 fatty acids. C. Simple carbohydrates. D. High sodium foods. Correct answer. B. Rationale: omega-3 fatty acids, found in foods like fish, flax seeds, and walnuts, can support nerve health and have anti-inflammatory properties, which may be beneficial for individuals with MS. Saturated fats, simple carbohydrates, and high-sodium foods do not offer the same benefits and may contribute to other health issues. Question 18. A patient with MS reports experiencing bouts of uncontrollable laughing and crying that do not match their emotional state. The nurse recognizes this as A. An expected side effect of MS medication. B. Pseudobulbar effect, a symptom associated with MS. C. A psychological response to the diagnosis of MS. D. Indicative of a secondary infection affecting the brain. Correct answer, B. Rationale: pseudobulbar effect, PBA, is a neurological condition associated with MS and other neurological diseases, characterized by episodes of uncontrollable laughing or crying that are disproportionate or inappropriate to the social context. It is not a typical side effect of MS medications, purely psychological, or indicative of an infection. Question 19. When teaching a patient with MS about managing heat sensitivity, which strategy should the nurse suggest? A. Taking hot baths to relax muscles. B. Wearing layers of clothing to maintain body temperature. C. Using cooling vests during outdoor activities. D. Increasing caffeine intake to enhance energy. Correct answer. C. Rationale: using cooling vests or other cooling products can help manage heat sensitivity. A common issue for individuals with MS. Heat exposure can worsen symptoms. Hot baths, wearing layers, which can trap heat, and increasing caffeine intake, which can lead to dehydration, are not recommended strategies. Question 20. A patient with MS is experiencing cognitive difficulties affecting work performance. What is the nurse's best recommendation? A. Apply for disability benefits as work will soon become impossible. B. Use technology aids like smartphones and computers for reminders and scheduling. C. Withdraw from social activities to conserve energy for work tasks. D. Increase caffeine intake for better focus and concentration. Correct answer. B. Rationale: using technology aids like reminder apps, digital calendars, and notes can help manage cognitive difficulties related to memory and organization. Applying for disability may not be necessary at this stage, and social withdrawal can negatively affect emotional well-being. Caffeine may not effectively address cognitive symptoms and could exacerbate other MS symptoms. Question 21. A nursing student is preparing a presentation on pharmacological treatments for multiple sclerosis, MS. Which statement should be included regarding the mechanism of action of natalizumab? A. It enhances the immune system's ability to fight the MS virus. B. It promotes the repair of damaged myelin sheath in the CNS. C. It blocks the migration of potentially damaging immune cells across the blood-brain barrier. D. It reduces the production of nerve-damaging substances by the liver. Correct answer. C. Rationale: Natalizumab is a monoclonal antibody that works by blocking the migration of potentially damaging immune cells from the bloodstream across the blood-brain barrier into the central nervous system, CNS. This helps reduce inflammation and the formation of new lesions in the brain and spinal cord associated with MS. The other options do not accurately describe the action of natalizumab or the pathophysiology of MS. Question 22. A patient with multiple sclerosis, MS, is experiencing significant neuropathic pain. Which medication does the nurse anticipate being prescribed for this symptom? A. Ibuprofen. B. Acetaminophen. C. Gabapentin. D. Aspirin. Correct answer. C. Rationale: gabapentin is commonly prescribed for neuropathic pain in patients with MS. It works by stabilizing electrical activity in the brain and affecting the way nerves send pain messages to the brain. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin, or acetaminophen, are less effective in treating neuropathic pain compared to medications that specifically target nerve pain mechanisms. Question 23. A nurse is teaching a patient with MS about the importance of physical therapy, PT. Which goal is the primary focus of PT in the management of MS? A. To completely restore all lost neurological functions. B. To improve strength and mobility, and prevent complications. C. To prepare the patient for eventual total dependence on caregivers. D. To increase the patient's medication tolerance. Correct answer. B. Rationale: the primary focus of physical therapy in the management of MS is to improve strength and mobility, maintain function, and prevent secondary complications such as contractures and pressure ulcers. PT can help patients maintain as much independence as possible, though it may not restore all lost neurological function. Preparing a patient for total dependence is not the goal of PT, and PT does not directly affect medication tolerance. Question 24. The nurse is providing dietary counseling to a patient with MS. Which dietary component should be limited due to its potential to exacerbate MS symptoms? A. Fruits and vegetables. B. Whole grains. C. Saturated fats. D. Lean proteins. Correct answer. C. Rationale: diets high in saturated fats have been suggested to exacerbate MS symptoms and potentially influence the course of the disease. Limiting saturated fats and incorporating a diet rich in fruits, vegetables, whole grains, and lean proteins can help manage symptoms and support overall health in MS patients. Question 25. A patient with MS expresses concern about the impact of stress on their condition. What is the nurse's best response regarding stress management? A. Stress has no real impact on MS, so focus on other areas of your life. B. While stress can affect MS, simple strategies like deep breathing can significantly reduce its impact. C. You should avoid all stressful situations to prevent worsening of your MS. D. Consider adopting comprehensive stress management techniques, including exercise, meditation, and counseling. Correct answer. D. Rationale: stress is recognized to potentially exacerbate MS symptoms or trigger relapses. A comprehensive approach to stress management, incorporating physical activity, relaxation techniques like meditation or yoga, and psychological support through counseling, can be beneficial in managing stress and its impact on MS. Avoiding all stress is unrealistic, and while simple strategies like deep breathing are helpful, a more holistic approach is often necessary for managing chronic stress. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.